Hello everyone! So today, we are going to learn about proper hand washing, donning and doffing of PPE, and donning and removing of gloves. So first, let us learn about the proper hand washing. For equipment and supplies, we are going to need an antiseptic soap, sink with running warm water, and paper towels or clean towel. Step 1. Place hand towel on non-dominant shoulder. Step 2. Assess hands. Remove your watch and jewelry. Step 3. Open or turn on the faucet. Then, wet hands. Soap hands forming a good lather. If soap is used, place soap in between palms. Next, rub hands, palm to palm. Then, right hand over left dorsum and vice versa. Palm to palm with fingers interlaced. Then, back of the fingers to opposing palms with fingers interlocked. Next, rub thumb in a rotating manner followed by the area between index finger and thumb for both hands. Then, rotational rubbing of palms forward and backward. Next, rub both wrists in a rotating manner. Then, keep hands away from the sink. Rinse hands and wrists thoroughly. Then, keep hands lower than arms to observe the principle from the cleanest to the dirtiest. Also, dry thoroughly from fingers to wrist. Close or turn off the faucet using your hand towel, placing a barrier between your hands and the faucet. And lastly, dispose used towel to the trash bin or to the area for laundry. Donning and doffing of personal protective equipment or PPE. For equipment and supplies. First, laboratory gown. Second, disposable ear loop, face mask, or any available face mask. Third, one pair of non-latex disposable gloves or surgical gloves. Fourth, face shield or eye shield or goggles. And fifth, proper dress code with closed-toe shoes. Steps on donning personal protective equipment or PPE. Step 1. Gather all the necessary items of PPE beforehand. Put on the scrub suit or proper dress code in lieu of the scrub suit. Second, put on rubber boots. If not available, make sure you have closed, puncture, and fluid-resistant shoes. Third, place the impermeable gown over the scrubs or worn clothes. Fourth, put on medical, disposable, ear loop face mask or any face mask. Fifth, put on goggles or a face shield. And lastly, put on gloves. Steps on doffing personal protective equipment or PPE. Step 1. Remove gloves. Step 2. Remove gown and roll inside out and dispose of safely. Third, remove face shield or goggles. Fourth, remove mask from behind the head. For early face mask, pull the strings from left and right ears while slightly bending forward and dispose it directly to the infectious waste. And lastly, perform proper hand washing. Donning and removing of examination gloves. For equipment and supplies, 1 pair of non-latex, disposable gloves or surgical gloves. Steps on donning of gloves. Take out the glove from its original box. Touch only a restricted surface of the glove corresponding to the wrist. Don the first glove. And fourth, take the second glove with the bare hand and touch only a restricted surface of the glove corresponding to the wrist. And fifth, to avoid touching the skin of the forearm with the gloved hand, turn the external surface of the glove to be donned on the folded fingers of the gloved hand, thus permitting to glove the second hand. And lastly, once gloved, hands should not touch anything else that is not defined by indications and conditions for glove use. Steps on removing of gloves. Step 1. Pinch one glove at the wrist level to remove it without touching the skin of the forearm and peel away from the hand, thus allowing the glove to turn inside out. Second, hold the removed glove in the gloved hand and slide the fingers of the ungloved hand inside between the glove and the wrist. Remove the second glove by rolling it down the hand and fold into the first glove. Third, discard the removed gloves with one hand, touching only the inner portion of the gloves. And lastly, don't forget to perform hand hygiene.